Good afternoon, everyone. This is our first of four CEO and CFO topical webinars. Our other three will be scheduled throughout this summer. Today, we're joined by Jennifer Cooper to be sharing best practices for 2024 revenue cycle strategies. So, if you have any questions, we're a small group, so feel free to unmute yourself or put something in the chat, and I will be watching the chat. With that said, Jennifer, I'll turn it over to you.
Thank you so much. So, today we are going to talk about the ensuring long term success in 2024 revenue cycle strategies. As you know, the revenue cycle is gaining momentum in the healthcare industry more so now than ever before. The traditional revenue cycle management processes, it's kind of apparent that they are outdated and they are falling short of a collaboration between the clinical documentation, coding, billing and compliance. So now more than ever, organizations need to focus on the strategies that protect the financial health of an organization and deliver the highest quality of care to the patients. Throughout the years, we've seen a lot of transformations in the revenue cycle. Not only transformations, but the billing processes have become much more complex, delayed reimbursements, changes in the regulations. It's pretty much a have to now for the leaders to focus on the optimization within the revenue cycle and look for ways to work smarter, not harder, and achieve more with less. When we talk about the drivers of the revenue cycle or the of healthcare, one of the things about healthcare operations is that the actual revenue typically involves more parties than just the patient. Um, there's actually several different parties that can be involved, including the individual who's receiving the care, the physician who performs the services, um, or orders the services, the third party payer. Um, Throughout the transactions, the customer is the patient. Those services generally must be ordered on behalf of the licensed professional. The party that pays for much of the cost of the services that has the contractual relationship with the patient, and that same party has a separate contractual relationship with the provider. The terms of these arrangements all have a major impact on the revenue that is received by the facility. This is only a small portion of the drivers that have a direct effect of the overall well-being of the hospital. We're talking about drivers that may not directly interact with the organization, but have an impact on the organization, or those drivers that affect the operations directly. Some of these can be controlled by the organizations, while others cannot. The internal revenue drivers, they're mainly like your the number of providers you have in your organization, the volume of the organization, and the services rendered. Um, the drivers that are kind of out of our control include the government insurance rates, claim management policies, um, and the collections that we're actually getting from the insurance claims and pending amounts from the patients. Performance improvement opportunities. You want to establish plans for areas that the organization can improve in. Here we've got the operating, the financial, markets, and the value, and some examples of each. Of course, the program and services in a health system, they're highly connected with and dependent upon other organizational functions and operations. Prioritizing improvements that streamline the key processes within the organization. This could include whether you are going to strengthen your departmental supply and your inventory management system, or maybe you can reconfigure your department work areas to improve workflow and capacity, redesign roles to meet challenges within the work requirements, determine which components of the organization should be produced internally versus partnering with an entity that could assist, identify marketing opportunities and growth. These are necessary for building and sustaining the operating margins, improving the functional processes that have the greatest impact on service, quality, and the cost of care. And then lastly, aligning your resources with demand, ensuring that the right resources are available at the right time to fully meet the work demand. As you can see, there's a lot that goes into the revenue cycle. From managing the patient's registration and scheduling to submitting claims, processing the payments, it takes a team to keep everything running smoothly. One of the key areas you want to look at is to evaluate your revenue cycle functions and make sure that there is a fair distribution of work, that the roles are defined, and that the tasks are divided equally and incorporated and monitored. So there's real risk involved in not distributing the workload in a equal way. So you want to focus on that workflow process that is based upon specifics of the organization. Some examples would be like a financial class breakdown compared to the number of employees. Look at your ratios. If the majority of if you have 60% Medicare patients, and 2 billers, but you have, 6 billers between the rest of the payers, you might want to look at shifting some of those over to the Medicare to kind of equal things out. Make sure that your team members are crystal clear on their roles, making a list of all the work that needs to get done, and assigning tasks according to each worker's specific function, position, and strengths. You definitely don't want to end up with 10 outfielders and no one at first base. Stating the objectives that you're trying to achieve, as well as emphasizing the level of effort and engagement you expect. You also have to be flexible because the workload might not always happen the way that it's planned. Um, the workload isn't static, so you may have to have different strategies in different situations depending on the circumstances. You also want to create a culture that values productivity over the hours worked by openly appraising those strong performances. Employees are hard to find these days. In addition, resources are limited and costly. Um, you need to move towards a staffing model that has a specialized approach. Billers have an increasing amount of pressure and responsibility. So, when looking at positions, you might think about like a claims specialist that's focused on denials and appeals, and focused on the reimbursement changes. This would allow the biller to focus on current claims and assist in getting reimbursed faster. You must also continuously invest in staff training. Um, how can you expect your employees to understand the processes included in their jobs or how their tasks impact the revenue cycle without the education? S- I'm sorry, I have to move this real quick. Okay. So, how does the revenue cycle impact the organization? Um, the financial stability of the organization. The efficient revenue cycle processes, of course, maximize your revenue flow. And we all know that that is essential for operating. Patient satisfaction and engagement. The management of the revenue cycle directly influences the patient experience. Accurate and efficient billing processes enhance patient trust and satisfaction. And of course, we all know satisfied patients are more likely to return for future services. And the operational efficiency, of course, the well managed revenue cycle reduces the administrative burdens, which then allows for a focus towards the patient care and compliance and risk management. You, of course, reduce the risk of legal penalties and audits by having an efficient revenue cycle. A study that was recently done showed that the revenue cycle management affects the hospital profitability and equity capital. These are two critical financial indicators. Patient revenue and revenue collection speed were also factors. These factors influence overall financial sustainability. So, some challenges in the revenue cycle include dealing with denials and rejections, infi- inefficient billing processes, frequent updates in compliance and regulations, collecting payments, And of course, ensuring that your data is accurate. Successfully overcoming these challenges is essential for maintaining financial stability as well as ensuring the organization's smooth operation. So, how can we do more with less? Let's take a look at some of our options. So, the revenue or patient registration, of course, is the first step in your revenue cycle process. Um, Traditionally, most of the processes of the RCM they were revolving around the back end task, like billing and collecting payments. Um, Now there's more of a greater focus on front end task, and the front end task includes the patient registration, patient access. This is where this sets the crucial foundation for the entire revenue cycle in healthcare settings. This stage involves several key activities that are essential for ensuring the smooth and efficient billing process, which of course has a major impact on the organization's overall financial health. The primary focus in this stage is gathering comprehensive and accurate patient information. This includes the personal details, the like the insurance data, the medical history, but you want to make sure that specialist attention is placed on the accuracy of this information. Errors here can flow through the entire revenue process. And of course, errors can lead to claim denials or claim delays. Other front end tasks include the scheduling. If you are maintaining an efficient scheduling process, it's assisting with overall operations of the registration. And then you can actually initiate the process of an accurate claim through the patient scheduling. Using technology to assist can help as far as streamlining your processes. Most patient portals these days allow the patient to enter basic information into the portal prior to check-in. So you have the advantage of, going ahead and verifying their insurance prior to the patient arriving, knowing what their copays are. Um, Basically having everything ready so that when the patient walks in, they're able to sign their documents and go on to receive the care. Um, you also want to make sure that the workflow is is being followed up on. So I know that registration clerks they have a tendency to say, "Oh, the patient was just here last month. We don't need the information." But you want to make sure that they are gathering regular updates and that the patient information is not being bypassed during the process. Another key area is you want to make sure that your staff understand the insurance and billing procedures and can clearly communicate the information to the patient if questions were to arise. Make sure that your staff know how to respond if they don't know the answer. You definitely don't want them, just telling the patient, I don't know, and leaving it at that. So, the eligibility verification is critical for the provider to maintain a healthy revenue cycle. This step ensures that the patients are eligible for the services provided and that the correct insurance information is used for billing. The function of patient eligibility verification in the revenue cycle is to ensure that the correct insurance information is used to bill for the services being provided. By verifying the patient's insurance information, healthcare organizations can avoid denied claims and ensure that they are billing for the services promptly and accurately. Of course, this helps to streamline the RCM process, it reduces the risk of denied claims, and increases the overall revenue for the organization. Despite its importance, the patient eligibility verification can be challenging. Some of the common difficulties include, the lack of access to real-time insurance information. If you're using an outdated system, you definitely want real-time information. Um, you also have, sorry, the possibility of insufficient patient information. Um, This includes, missing or incorrect policy numbers, outdated insurance information, or just in general incorrect patient information. You also have to take into consideration the complexity of the insurance policies. Um, they can be very challenging to be able to read. Healthcare also needs to be aware of the changes in insurance policies and have systems in place to verify the eligibility quickly and accurately. So, obtaining authorizations for services ensures that the services to be rendered is covered. This is the area that I think most revenue cycle directors tend to, not say dislike the most, but it causes the most uproar, I think. Because of course, if you don't get the prior authorization at the time, prior to the service being rendered, the chances of you being able to collect payment, is definitely decreased. And a lot of that feeds upon the documentation that's submitted, the ordering provider, whether they contacted the insurance company from their office. Um, but basically, it's one of the important areas, and it ensures that the service can be provided in a timely manner, and that it is an approved service. So you have to let go of the outdated processes and systems that are no longer efficient. So when it comes to strategies for improvement, you want to look at your current revenue cycle process, see whether there's any immediate improvements that can be made. Review your policies and procedures on a regular basis to ensure that the process is running smoothly. Are your staff members fully trained and educated on the front end processes of the revenue cycle? They must understand how to communicate with the patients to obtain accurate and complete information for billing purposes. And they need to understand the basic information around those insurance policies. Um, of course, it's essential to the success of the entire organization. You can do hands-on workshops that help staff understand um, kind of the challenges that come about during the registration, have them practice their problem solving skills. You also want to look at how thorough and effective your current verification system is. It has to be comprehensive and effective. And of course, a comprehensive and effective verification system um, is critical to the organization, the organization process. I'm going to grab a drink real quick. Another area you want to make sure that you have clearly defined policies and procedures, and that the staff are trained upon those policies and procedures. You also want to use technology to your advantage. Technology and automation tools can significantly improve the accuracy and efficiency of the patient eligibility verification process. Automated systems provide the quick and accurate patient information, of course, reducing human error and streamlining the RCM process. In addition to streamlining, you can also use the data to provide a deeper insight into like your billing patterns, your potential areas of revenue leakage, and you can also predict the payment behaviors. Machine learning algorithms can be used to produce claims before submission, reduce denials by identifying potential errors. Applying the technology allows you to significantly enhance your workflows, improve accuracy, and ultimately optimize the revenue cycle management process. So, now we're going to look at some of those challenges. We're going to start with denials and rejections. We all know that they are significant roadblocks in healthcare. Um, A lot of the common causes include eligibility issues, discrepancies in patient insurance information, and errors in coding or claim submission. So you want to make sure that the eligibility is being verified at every visit. You can use those automated verification tools to ensure that the insurance details are accurate. Once again, we talk about educating your front desk staff about the importance of verifying insurance coverage and developing the clear procedures for responding to denials. Um, More so these days than ever, it seems as if the denials are not being worked as they come through. You have 45 days, most of the time, from the time of the denial to appeal that claim. So you want to make sure that you are not leaving money on the table by just leaving those denials there unworked. So your compliance and your regulatory updates, it's pretty much a constant in the healthcare industry. You have to find a way to stay ahead of those changes and not just a best practice for facilities, but it's a necessity. If you are not keeping up with those, you're definitely going to run into some issues. So some areas of focus would be your coding standards. Of course, changes in coding standards can impact the billing, and you have to be prompt with getting those changes put in place. The billing rules, understanding and applying the latest billing rules, whether it be payer specific or, and they change on a daily basis, it seems like. So you want to make sure that you are keeping up with what is going on the billing side. Documentation requirements, accurate and thorough documentation. It's not only essential for patient care, but also compliance. And of course, your insufficient documentation can lead to claim denials and compliance issues. And then the reimbursement policies. You want to make sure you're keeping up with changes in reimbursement models, especially as we shift towards a value-based care. Those those policies can have an impact on how services are billed and reimbursed. On the compliance side, you also want to make sure that you are, conducting those ongoing training sessions to ensure that they are up to date with the latest regulations and standards. You could also implement software to monitor compliance. You can flag potential issues and streamline the regulations. And one of the things that wasn't on my slide, but regular internal audits and quality checks can identify areas of noncompliance before they become a problem. A strong internal audit system is the most effective against compliance risk. And encourage your organization um, to, adopt a policy or a culture where compliance is shared amongst the team. And that there's no fear that if the staff was to report something that there would be issues arise from them reporting it. So patient engagement, um, improvements in patient experience not only improves your quality of care, but it also has a positive impact on finances. Patient experience is influenced by the interactions the patient has with the organization, whether it be the physician, your registration clerks, the nurse, um, the cashier, or the actual treatment and diagnosis, or the customer service. When you go to a restaurant, you're paying for the food, but that doesn't mean that the restaurant should only focus on making sure that the customers are satisfied with their food. They also have to make sure that the restaurant meets the customer's expectations as far as the prices being paid and the service and staff providing exceptional service too. Healthcare is no different. It's not just about the care being provided, it's about the overall patient experience from beginning to end. Negative patient experiences can have a major impact on the overall health of the facility in multiple ways, including the patient seeking care elsewhere or decrease payments as payments or payers do move towards the value based payment model. So, how can you improve patient experience? For organizations, you can focus on the processes and systems that affect the patient or the physicians. You look at the payer groups and other partners that are providing or assisting in that patient care. Um, some areas that you could look at as well, the financial transparency, making sure that the patients are fully aware of the cost of their services, offering convenient billing and payment options. You want to make it easy for the patient to work with you. So, if that means allowing them to pay their bill online or even the patient portal, I think most of the patient portals also are given the ability for patients to make payments on the actual portal. Improve your communication and education. Make sure that you are communicating with the patients of what services they are going to be receiving, the outcome, and educating them as far as what to expect. Expediting the registration and insurance verification process. We talked about that earlier. Allowing them to use that patient portal to go ahead and get pre registered and have all of the information. Um, they just simply don't like to wait or do that paperwork when they're there for care. And then it also gives you a chance to encourage the financial responsibility. You can have that discussion with them about their portion of the services. By empowering the patients with the financial transparency, you're letting the patients know upfront what their financial responsibility is. That helps to eliminate the unpleasant shocks, reduce the number of billing inquiries, and of course, speed up the payment collection process. If you register a patient and they know that they're going to receive a bill for $20, there's not that shock when they actually get the bill for $20. And they tend to pay it quicker if they know it's coming. Implementation of the billing and payment options. This, of course, we talked about it. It improves the payment compliance and it gives the patients greater financial control over their medical care. And of course, keeping the patients informed and involved through the billing cycle decreases the number of errors and, of course, prevents payment delays and enhances the overall collection process. So, with rising healthcare costs, an increasing amount of responsibility for payment is being shifted to the patients in the form of copays, deductibles, and out of pocket expenses. When it comes to improving the communication and transparency, you want to make sure that you are establishing those clear channels with patients regarding their responsibility. This might include detailed information on copays, deductibles, and any potential out of pocket costs before the services are actually rendered. The flexible payment options offer a variety of payment methods, including the online payment portals, mobile payment options, um, and of course, the traditional payments like the checks and credit cards. Um, Train your staff in those financial conversations. Make sure that they know how to interact with the patients and how to discuss those financial discussions and make sure it's done in a sensitive but effective way. Also, you want to make sure to emphasize the importance of empathy. These interactions to maintain a positive patient experience for sure. Create You can also create a culture where the staff are encouraged to stay informed about the latest practices and changes. Um, so now we are going to talk about data accuracy. So regular audits can help prevent the costly errors, ensure the smooth operation of healthcare services. When we look at data accuracy, we want to make sure that we are checking for patient information accuracy. ensuring that all of the patient data from personal details to their insurance information is correct and up to date. You also want to make sure that that information is transferring from your system to your claim form correctly. Um, their systems can have issues to where they drop information. So you don't want to set yourself up for a compliance issue by not checking those things on a regular basis. Charge capture and coding. You want to make sure that you verify that all the services are accurately recorded and coded for billing. And then, of course, you want to ensure that those statements and claims are error free and compliant with payer requirements. Um, Implementing the regular audit schedules and then conducting them at intervals, various intervals of services. Um, Focus the audits on the high impact areas, such as like your coding accuracy, your data integrity, and the claim submission correctness. You want to identify and prioritize areas within the revenue cycle that are more prone to errors, like complex medical procedures or services with frequent coding updates. So, if you have something that tends to be more of an issue when it comes to coding or billing, make sure that you're choosing those for some of your audits as well. And make sure you're allocating more resources and attention for auditing those high risk areas. And of course, if we keep talking about training the staff, make sure that you um, train staff on a regular basis for the data entry, the coding, the billing, um, especially after you've conducted the audits and you have your findings. So the staff training, proper training and education, of course, that's essential to the success um, of the organization. And I know that it was touched on several times already, but that is a key in the overall revenue cycle process, whether it be from starting out with patient registration, just making sure that they know the basics, that they understand why they're running the insurance eligibility, how that affects the outcome of the patient's bill, to the you know, cashiers that are posting the remits and how to read the remit. More so now than ever before, it seems as if lack of knowledge is one of the key challenges within the revenue cycle. And just making sure that your staff, is comfortable and confident in the processes they're taking is key. So when we look at preparing for future trends, one of the things that we look at is how can we stay or how can we maintain financial stability, prepare for the future, all while providing good patient quality care. Automation, of course, is the big topic right now. Um, you want to become familiar because we are moving towards automation and, of course, artificial intelligence. But be familiar with the different types of automation available and how you could implement them into your revenue cycle. One of the things about automation and artificial intelligence is it's not going to do you any good if you don't know where your problem lies. You have to know, if you have reoccurring issues with your patient eligibility process or your prior authorization. You have to be able to identify those areas in order for automation or the AI to actually assist your organization and make things better for you. Once you identify those areas and you know that, hey, we have a problem with patient eligibility, it's not getting done, then you can implement the automation and you can see results, from that process. Um, the artificial intelligence, you can use that to improve your revenue management. It also gives a decision making for the smooth processes of the revenue cycle. But once again, you have to be able to clearly identify where your problem lies for the artificial intelligence to e- basically produce better results for you. As we shift towards value based care, we're going to have to make sure that we focus on improving those patient outcomes and meeting their financial performances. Create cross functional collaboration. You can ensure your revenue cycle strategies are in line with your healthcare's organizational overall goals. And you want to make sure that your staff is clearly aware of what those goals are as well. Invest in regular training, development for your staff so that they are in the know of the latest practices, technology, and regulatory changes. And of course, we talk about that patient billing and focusing on the patient and communication strategies to enhance patient experience, which of course has a positive impact on your revenue cycle. And that is the end of my presentation. We can open it up for questions now.
I'm not seeing any come in. Jennifer, thank you so much for your time. And everyone, thank you for joining today. As I mentioned, we have three others scheduled. However, the topics are to be determined. And Jennifer, thank you so much for your time today.
Thank you for having me.
All right, thank you, everyone. Have a great day.